Thank you for registering on the MWS Matrix portal. The purpose of this video is to help you understand the different sections of the portal and how to use each of those sections. What you see on the screen is the page you'll land on when you log in. You start with two choices. You can go to My Dashboard, which would be the Caregiver Dashboard, or you can go directly to the Patient's Dashboard. On this page, you'll also see an icon in the upper right. After you go to My Dashboard, we're going to look at the Caregiver Dashboard first. Here you have the ability to change patient. That would come into play if you had more than one patient listed under you as the caregiver. You can go back to My Dashboard, which is the Caregiver Dashboard. You have settings. This is where you would set up your notification type that you want to use. We'll talk about notifications when we get to medications for the patient, but if you want to receive reminders about medication or prescription refill, or for forms for that matter, you do it here. It's also important that you set up your time zone. You click edit and you can change those different sections. You toggle, so if you want to receive a text message or an email message or both for medications, prescriptions, or forms, you do that here. You also have the opportunity to download a user guide, which goes into the same level of detail that I'm talking about here, but if you want to have it in written form, something that you can refer back to, you would use the user guide. So that's settings we were looking at. Let's look at general information. Again, this is editable, and this is really just the basic information about the caregiver: name, address, email, and phone number. You edit at the bottom, you click the edit to make changes. Journals, I'll talk about this under the patient dashboard. It works the same in both sections, but it allows you to basically create a journal, just like you would do having something that you're writing in. We'll talk about that again when we get to the patient dashboard. Messages, this is where you would find your inbox. This is where the portal administrative team would send you emails. Right now, if you want to email back to us, that is not part of this page. And if you were to click on Contact Us, that message would actually go to Across Healthcare, who is the organization that has built this platform. We're going to make a change to make it easy for you to contact the administrative team. Right now, I'll just give you an email address for me at the end of this tutorial, and you can email me directly. Forms, here's where you would find something that the foundation might want you to complete, such as a survey, anything like that. It'll show up here. Once you complete it, it moves over there. And then documents, you have the ability to upload any document that you might have on your computer. We'll talk about that also under the patient dashboard. Go back to the main screen for the caregiver dashboard. Now we're going to go ahead and look at our patient. We click here and it goes to the patient page. The first thing that you'll see on this dashboard is what has been set up as medication reminders. We're going to show you how to do that. But right now I have it set up that at 7 a.m. and 7 p.m. there will be text alerts sent to me for dosing trileptal. Also, there are symptoms that I have been recording and activities I've been recording for this patient. This will all make sense as we go through the various sections here. General information, again, this is editable, and these will provide information about the patient. It's important here that you set your privacy settings. The only thing that will be shared is your phone number, your email address, and your name. unless you check any of these other areas. So you can either allow all of your data to be shared, you want to be asked before sharing anything, or you don't want anything shared, again, except name, address, and email address and phone number. So that's general information. Medications. Here you can set up the medications that the patient is on. As you can see, I've already set up trileptal. It's in suspension is the form that we're using. Dosage, right now the system does not allow you to put the dosage that you are administering. This is the dosage, the way that it's packaged. That's going to be changed in the next version so that you'll be able to put in the specific dosage that you're using. The frequencies twice a day. I set this up for a refill on March the 12th. I have it one refill, and then here's where I have set up the reminder. And you can see I've set it up every day, 7 a.m., 7 p.m. And you saw that on the main dashboard screen where that showed that that had been set up. You also, by going to these three dots on the right, you can edit the medication, you can edit the reminder, you can stop the reminders, or you can delete the entry entirely. Let me show you how you would add a medication. You click on add. It asks if you know the NDC code, which most people do not. You just click next. I'm going to add Keppra. So I just start typing and it will pop up in the drop-down window. It is a prescription. I go to next, pick a form. We're going to use solution and pick a dosage. Again, it's the way it's packaged. It's not the dosage that you're going to dispense. We will be changing that. Next, the frequency. This is going to be twice a day. And we're going to set up for one refill, and that refill will come due on March the 12th. And we save. Here we have Keppra. Now I want to add, or I should say, I can add a reminder. I would click reminder. It asks me, do I want a medication reminder or refill reminder? In this case, if Keppra is given at the same time that trileptal is, you may not want to set up more than one reminder if they're for the same time. If you feel more comfortable wanting a reminder for each, you can do that. You can, again, do a separate refill reminder here. So you remind me how many days before the refill date. Not going to do that on this one, but that's where you would put your reminders. Let's take a look, and you can add as many medications here as you need to. Let's take a look now at symptoms and activities. We'll start with symptoms. You see that it's in basically a weekly calendar format where you make your entries. I've set some up already. So the symptoms that I've used are sleep quality, frequent awakenings, bowel issues, constipation, mood, aggressive. And I've made entries. So here, if I click on that, I can see that on February 14th, I had indicated this was the third day with constipation. The condition had worsened. Here, it was mood, very aggressive today at home and school. Just a way for you to keep a record of symptoms that might be occurring that you want to be able to refer back to. The way you would add a symptom is you click on create. You can put in something that is specific for your patient. We have listed most of the symptoms under organizational symptoms. Under seizures, we even have the seizure type broken down: sleep quality, restful, intermittent, frequent awakenings. We have mood. We've done a number of things here to try to make it easy. Let's go ahead and add a symptom. We're going to use an organization symptom, and we're going to add a seizure, and we're going to add a complex seizure. Now you see that got put on the bottom here as an activity, or I'm sorry, as a symptom that we're looking at. And now we want to add a specific entry. So I'm going to click on the add. We're going to say this occurred on the 19th. The time, if it's a seizure, you might want to put the time that it occurred, 11 p.m. You can put notes. Let's just say this lasted 7 minutes. Severity scale is not working right now. We're going to get that changed. And then you can indicate whether the symptom is improved, worsened, or stabilized. We're going to just put stabilized. We're going to save it. And now you can see here on the 19th, we can click, and that's the entry that we just made. If you want to eliminate an entire symptom, you just click the delete here. Or if you want to remove a specific entry, you can delete it by going to that specific entry. All right, let's do the same thing. And again, here's where, and you can go back as far as you would like to make these entries. Now we can look at activities. Right now, the ones that I've previously used include a medication change, doctor visit, and physical therapy. Medication, I made an entry here that we increased the trileptal dose to 9 mLs from 7 mLs BID. So important because medication changes may impact symptoms that you might see. So if you're adding a new medication, is there more aggression? Is there more inability to sleep? And the way you record these, you'll be able to see graphically how these match up with each other. I'll show you that under Insights, but under Activities, if you were going to add an activity, you do it the same way. You go to Organizational Activity, and you might want to add physical therapy. Add that. I'm sorry, we already have physical therapy. Perhaps you had a day that you were out in the sun a lot. I know for a lot of individuals, sometimes prolonged sun exposure leads to seizures. So that's why that might be in there. But again, you can add your own in here. So we've listed a number of symptoms and activities. How do we look at those? If we go to Insights, you can start to see now a graph or a chart showing the things that we've listed. You can click on each one to see what the details were. So remember, we had an entry here on February 14th, constipation. The way you set this up is you click on filters, and you can pick up to 6 symptoms and activities that you've used. We've used, in this case, I'm using 4 of the 6. We can add the seizures in here if we would like to, and we say apply. Now those 5 are listed here along with the dates, and if you scroll up at the top here, you can look at a wider time range. And this might be helpful, as I said, if there's a medication change, what happens afterwards, how frequent are seizures occurring, things that might be helpful in putting a full picture together of how these activities and symptoms are connected with each other. A lot of this in this platform will make sense to you as you start to play around with it. You really can't make a mistake. Anything that you enter, you can always delete. It's pretty intuitive. And the best way to get familiar with it is just to try doing these different things. Journals. This would be where you might want to keep track of information under a particular category, just like keeping a written journal. So I've set one up here for doctor visits where my intent would be to list every time there's a doctor visit and perhaps what might be discussed there. So in this one, I made an entry for the 17th concerning an ear infection. Here, went to the neurologist, and this is where we increased the dose of trileptal. Then I have a medication. You might want to keep a journal of every medication change that's occurring. Again, let's look at how you would add something here. So we're going to create, and you have two choices. You can add something to an existing journal. So in this case, let's do an additional entry into doctor visits. And we're going to put this as pediatrician follow-up. Let's put this occurred on Saturday and recheck ear infection. Let's say it's now all clear. Okay, so we can find that under doctor visits. You'll see they're going chronologically from the newest entry. So again, a way to allow you to see continuous information and be able to look at dates and things like that. And then if you wanted to add a whole new journal, you would do, instead of picking one of your existing ones, you would say add category. And then a new journal would show up here. Take a look quickly at messages. As I mentioned, this is where any message from the foundation admin team would come in. You know, under journals, let me go back here real quick. Another example here might be you want to have a journal for IEP visits or IEP meetings, just as an example of another category. Said messages, forms, same thing. These are forms that the foundation would send that we would want completed. Obviously, this would make more sense in the caregiver section for forms to be completed. Mentioned about documents. This is where you can upload here. Just as an example, I've uploaded Mowat-Wilson Syndrome Foundation letterhead. If I wanted to see that document, I would click here on the download, and I could then click on the item, and now I have access to it. Let's show how we would add additional document. I'm going to upload, takes me here. I'm going to upload the MWS growth charts, and I'm going to save it. Now you can see here, let's say you're going to a new physician and they're concerned about height and weight and things like that. Might be nice to be able to have quick access to the growth charts. Again, you would be able to download it immediately. If you want to get rid of one of these, you just click on the delete over here. But nice way to have multiple important documents in one spot. Just as we were talking under journals about IEPs, you may want to have the most current IEP here that you can access quickly. The sharing center, this can be a little bit complicated. This would be like advanced. I will do a separate video on how to use the sharing center. Basically what this does is allows you to share any of the patient's information with a particular doctor. So if you were going to a new doctor and you wanted them to see several things before you were there, you would be able to set up a link, and you indicate which things you want to share. You indicate how long you want that link to be available. and then you would send the link to them via email, and you would give them a password that's created when you create this link over here. Again, nice functionality, but something that you might want to get more comfortable with the rest of the system before you go on to use that. So we're going to go back here to the patient dashboard. Again, now you can see where this came from. We had set up a reminder under medications. These are the symptoms and activities that we've been using. Each time we add a new one, it will come into this section. Now, since this is the first version of this portal, there will be changes coming over the next 2 to 3 months, making it easier to use. Things like the dosing on medications and the communication functionality. But I think it's very usable in its current form. As I mentioned, if you do need to communicate, this is my email address, al.triunfo2@gmail. Please feel free to email me at any time with questions that you have. I can either respond by email, or if we need to actually have a phone call, we can set that up. Again, thank you. I hope you find this platform beneficial, and I look forward to further communications.